Hello, my name is Carlos Malvestuto. I'm an associate professor in the Division of Infectious Diseases at the OSU Wexner Medical Center. I am a COVID research investigator as well, and I've worked on a number of clinical trials, both on the treatment and the prevention of COVID. So we are at a very important point in the pandemic. There is a lot of transmission of the virus, and this is the result of the emergence of a new variant of the virus, the so-called Delta variant. The virus continues to evolve, as all viruses do, and this current version of the virus, this variant, is much more transmissible. So it's much more contagious than the original variant. We can compare it to something like chickenpox in terms of how easy it is to transmit this variant from one person to another. As a result of this, we've seen that the numbers of new cases have increased very significantly. And what we're noticing is that those patients who are not vaccinated are at very high risk of ending up in the hospital. So the number of hospitalized patients has increased, but almost all of them are unvaccinated. So this highlights how important the vaccines are. Fortunately, we have three vaccines that have been approved. The three of them received what is called emergency use authorization, where the FDA has evaluated the data from clinical trials, looking at both the efficacy, so how well they work, as well as the safety data for these vaccines. One of these vaccines, the Pfizer-BioNTech mRNA vaccine, has in fact just earlier this week received full FDA approval. So this means that FDA has evaluated not just the clinical trials data, but also the follow-up data, as well as the real-world data from the use of these vaccines, and has declared that the vaccine is both safe and effective. And we know this, the numbers actually bear this out. We know that these vaccines are extremely effective at preventing serious disease. And this is very important because even though somebody can get symptoms, even if they're vaccinated from COVID-19, what they're likely to have is very mild disease. Those patients who are unvaccinated, however, those are the ones that are much more likely to progress to very severe disease that may require hospitalization. This is particularly important for our patient population and our folks in our community who may be in school, who need to interact with others. And if you're not vaccinated, then you are especially vulnerable. I can, now that we've vaccinated more than 200 million people in the US have received the Pfizer vaccine, and close to a very high number as well has received the Moderna vaccine. A smaller number have received the Johnson & Johnson vaccine. But what we know is that these vaccines are extremely safe. This incidence of serious adverse effects, it's extremely low. And by that, I mean it's astronomically low. So the risk of some complications, like for example, clots or myocarditis, is in the rate of about 1 to 5 in a million. So again, these vaccines are considered extremely safe. And for patients with disabilities, it is very important that you stay protected and that those around you, your families, your aides, the people working with you, if they're all vaccinated, then you can continue your life and your quality of life will not be affected. But we do want to make sure is that people remain protected. So I encourage everybody to get vaccinated. It is really the only way that we'll be able to get through this pandemic so that we can continue to have go about our daily activities in a normal manner. So it's very easy to get the vaccine now. We have plenty of supply. You can just walk into lots of sites here at the OSU Wexner Medical Center, or you can walk into your local pharmacy or many institutions around town. So if you're not vaccinated yet, then please get vaccinated. And if you are vaccinated, please encourage your loved ones and those around you to get vaccinated. Thank you.